Hello, I'm Dr. Benny Shao. Today I'm going to clear up some misconceptions about the condition known as lazy eye. The proper technical term for lazy eye is amblyopia. This is when one or both eyes is unable to see 20/20 regardless of the lens used in front of that eye. The typical treatment for lazy eye is to use a patch in front of the good eye in order to force the lazy eye to work. The first common misconception about lazy eye is that you can't treat it after age 7. This is a myth. Once upon a time, there was a theory proposed stating that you can't get lazy eye after age 7 because prolonged covering of one eye couldn't induce it. This was then incorrectly interpreted by some people to mean that you can't treat it beyond age 7. In any case, neither statement is true. There are certain circumstances that make a lazy eye very difficult to treat, but age is not among them. The next misconception about lazy eye is that you must patch the good eye for long periods of time in order to achieve good results. The longer the time frame, the better the results. This is also untrue. Studies have shown that short periods of patching combined with active vision training produce equal, if not superior results compared to patching for long periods of time such as 8 to 10 hours per day. By definition, patching does not involve the use of both eyes simultaneously for the purpose of developing adequate 3D depth perception. Therefore, it is very likely that patching by itself will not result in acquiring perfect 20/20 vision in the lazy eye. The final misconception regarding lazy eye involves surgery. Surgery is not recommended for lazy eye, rather it's sometimes recommended for an eye turn, also known as strabismus. This is when a patient is unable to use the two eyes together and therefore uses one eye for looking while the other eye turns in, out, or sometimes even up. A surgeon will sometimes recommend surgery in order to straighten out the eye so that the eyes appear straight. However, the success rates for surgery are anywhere between 30 to 80%. Why such a big range? This has to do with the definition of success. In many of the studies where the success rates were reported to be high, their definition of success was cosmetic alignment of the eyes for a period of 6 months following the surgery. This does not involve measuring to see whether the patient was actually capable of 3D depth perception, nor are they looking at whether the eyes stayed straight beyond 6 months. This is why many patients end up getting multiple surgeries to try to keep the eyes straight and in the end up not getting normal depth perception. What we do in vision therapy is to try and actually achieve normal depth perception so that the eyes will remain straight following therapy. This is a very different goal than to just try to get the patient's eyes to look straight without changing how they see the world. This concludes our top 3 misconceptions about lazy eye. If you have any other questions, please feel free to contact us today. Thank you very much for watching.